Hi everyone, Morgan here. So today I have a review of Jase Medical, where they offer antibiotics to people via the internet. All right, let's take a look and dive deeper into how this whole thing works. So first of all, I have a lot to say on antibiotics and medications in general for preppers, but I think that antibiotics have been one of the hardest things for preppers to acquire. You know, a lot of people go to like the fish antibiotics and things like that, but I think the very first thing I want to talk about when it comes to antibiotics in general is knowing. First of all, it's diagnosing what you have. So if you're going to self-medicate anything, whether it's over-the-counter medications or prescription or whatever, first you have to diagnose whatever it is, that you think you have, right? And some things are very difficult to diagnose unless they have some type of, blood work or x-rays or something that's telling you, yes, that's it. And so self-diagnosis is not, I wouldn't say it's dangerous, but it can be very tricky, especially if you're not sure exactly what it is, because I'm sure all of you've gone online and searched WebMD, right? I have these symptoms, and you finally realize that you're dying, right? But really, you just probably have allergies or something. So, it's really easy to say, oh, wow, I have this condition or this condition or this condition, And so, even doctors, take educated guesses, but I'm just saying, first of all, you have to diagnose what you actually have. Then you have to figure out the treatment methods for that. Is it just some bed rest, liquids? What is the treatment for this, right? I think it's really great to have medications on hand, especially antibiotics. Again, preppers have been trying to get around the antibiotic thing for a long time. What are natural antibiotics? I've talked about that before, but having, prescription antibiotics on hand is nice. Okay, so let me actually talk about Jase Medical. So first of all, before you even get this, it's basically a telemedicine thing. So, one thing about COVID that I've really liked is that there's way more telemedicine now. You can do, therapy through Zoom. You can talk to doctors through Zoom. You can get diagnoses through Zoom. I mean, that's how it's working these days. And I'm not gonna lie, I kind of like that, especially, I feel like if you're sick and you call somebody, why do I have to get up and go somewhere when, I could just talk to you on Zoom and be like, I have the flu and, whatever. So I appreciate telemedicine. We've actually used telemedicine a couple times for our children, and it was really nice. I remember back in the day, I know I'm kind of all over the place with this. It's just about Jase Medical, but I wanted to, kind of reel in the point that telemedicine is a good thing. When I was growing up, there was 1-800-NURSE. It wasn't called that, obviously wasn't the number, but it was a nurse hotline, and my mom would always call it and be like, she has these symptoms, and the nurse would be like, okay, give her this. I thought that was pretty cool. So, that was way back in the day. Now there's telemedicine, and it's pretty nice. So Jase Medical kind of works on that telemedicine, and they're not, breaking any rules or anything like that. But one thing that I really want you to pay attention to is when you're filling out the survey and when you're doing the telemedicine and it asks you, what other medications are you taking? Be truthful, because some medications will interact poorly with other medications. They could either make you sick or it can make the medications just simply not work, right? So we want to make sure that we're being as truthful as possible, whether over-the-counter medications or prescription medications. Be truthful about the medications that you're taking. If you can't get the antibiotics because of the medications that you're taking, so be it. I would rather be safe and not be mixing meds that shouldn't be mixed than just lying and getting this and then taking it and getting sick or, sicker or whatever the case may be, right? Now, so be truthful with that. So here are the medications that are inside. They are prescribed to me, my full name, okay? So it has 5 different types of antibiotics here. And like I was saying earlier, the hardest part is probably going to be diagnosing. And then the next hardest part will be what is the dose that I should take and how long should I take it? I think I've talked about this before. If not, I've talked about it to other people, but what is the dose? How long do you need to take it? And it varies from condition to condition. So they have included this really nice emergency antibiotic guide. It talks all about this stuff. It even talks about warnings. It talks about what is actually included in your kit. And then it talks about, it does talk about shelf life. You really do want to keep these medications in optimized room temperature of 68 to 77 degrees away from direct sunlight. So just keep it in this bag in a nice cool condition. Don't put it in the fridge. Cool, dark place. Okay. So then it has a little contents by drug. So you can say, okay, well, I have pneumonia. Oh, this is okay, let me look at this. Okay, let's go to page 4. Oh, it also has contents by condition. So if you're like, I feel like I just got bit by an animal. Which one do I need? Okay, I'm going to go to number 2. So let's say bite wounds. Any kind of bite wound, including bite wounds, should be thoroughly cleaned. Consult with your preferred first aid manual for instructions on how to properly clean the bite wounds. Used to prevent infections after an animal bite would be take 1 tablet by mouth twice per day. To prevent infection, continue for 3 to 5 days. To treat an infection, continue for a minimum of 5 days to 14 days. This is the information that's super important. And this is the information that most people don't know about. They'll get the fish antibiotics or any other antibiotics, right? The extra antibiotics. And they'll just be like, okay, I have these antibiotics. Now, 1, you have to diagnose yourself, and then 2, figure out how much to take, right? Based on, whatever ailment that you think that you have or has been diagnosed or whatever. So this is very important information. And I like that it also says, like pneumonia, it says, without the aid of chest x-ray or blood tests, you must rely solely on signs and symptoms to help determine if pneumonia is present, such as fever, chills, chest pain that worsens with inspiration or expiration, shortness of breath, and a cough that produces phlegm, basically. So amoxicillin can be taken in conjunction with either, the other ones. I don't even try to pronounce most of these antibiotic names because I know amoxicillin, it's basically it. To cover most causes of pneumonia. So it does say, and then it says exactly take 1 tablet by mouth twice per day. They're all different though. And it also does caution you, like breastfeeding, pregnancy, these kinds of things. So, I remember when I was pregnant both times that I couldn't be on antibiotics because I was pregnant. So that's just something that you have to keep in mind as well. And so there's just a lot of great information here. I really like that it comes with that guide. I think that was one of the hardest things to do when it comes to antibiotics and, over-the-counter meds and that kind of thing. Sure, I have the medications, but that doesn't mean that I know how to self-treat myself and how to, give that stuff to me. But Jase Medical makes it really, really easy. And I know this is like a really long, drawn-out thing, but I just want to caution people when it comes to antibiotics and things like that, you need to take it when you need it, when you actually need the antibiotic. Don't be taking it all the time. The more you take antibiotics, the less effective they can be. So it does say that on these medications, it actually says it's to discard within 1 year. So I got it this year in January 2022, and it says to discard in January 2023. But they say that antibiotics can last from 2 to 3 years. If you want to replace your antibiotics at any time, you can go to Jase Medical and replace them. And you'll just go through the same process again with the online physician, and you can get prescribed. This is all on the up and up. And when I say that, I mean that it's a real doctor prescribing you this stuff. So it's a real doctor saying, okay, you need some extra medications. Because I asked about that. I was like, how is the doctor prescribing this without you having any ailments? And it's common practice for doctors. This is the answer I got. It's common practice for doctors to prescribe medications either for emergencies or to have extras on hand. So they're basically just asking like a couple questions from you, and then you should be able to be prescribed. I'm not going to guarantee that you will, but you should be able to. Honestly, I do feel a lot better having this on hand, but I am going to further educate myself on diagnosing symptoms that need antibiotics, as well as when to take the antibiotics. So I'm going to look at that book, and I'm going to look online, and I'm going to look at things that will help me better understand when I might need to take antibiotics, but it's really nice to have this on hand, and I really appreciate that this service is out there for people, and it's pretty affordable too, as far as I'm concerned. I want you to head down to the link down below, check out all they have to offer. Pretty great setup they have. I'm pretty confident in everything that they have. They have a real doctor on staff. It's all in the up and up. Telemedicine's a thing, you know, all this stuff. So it's following all the guidelines that it should be following. Thank you all so much for watching. Conquer tomorrow by preparing today. And do not forget to click that link down below in the description to go check out Jase Medical. Talk to y'all later. Bye.